I'm Melissa Gibbons. I'm a genetic counselor here in Denver at the Children's Hospital. I work with Dr. Collins, who spoke yesterday. I have no disclosures. I'm hoping to talk to you today a little bit about who are genetic counselors, who should be offered genetic testing, types of genetic testing that exist, talk a little bit about decisions why we may want testing or may not want testing, because it is not a one-size-fits-all. And additionally speak about hurdles for genetic testing, discrimination, what to do after the results come, which I think is a really big part, and then talk about how we talk about our results with the family. So how many people here believe that they have met with a genetic professional, either a geneticist or a genetic counselor? Wow, actually not so many. So I want to take a second to talk a little bit about what a genetic counselor is. So we're typically the ones on the medical team that are wearing sweater sets and pearls. That's the joke about genetic counselors. Apparently we also like to bake, but I don't fit that mold because I haven't figured out how to do that at altitude yet. But in truth, genetic counselors are individuals who have a master's degree specifically in genetic counseling. It's a 2-year intensive program in which we do clinic rotations in all subspecialties of genetics. And then our coursework is heavy on the sciences, but it's also really heavy on how to actually talk to individuals and interact with people, and how to share important information in a way that people can understand. You'll see some terms such as a certified genetic counselor, and these are the individuals who have sat for our board. You must have graduated from one of these programs, sit on a board, and then maintain education over time, which I think is really important because the field of genetics is so rapidly changing that on a daily basis, I need to be catching up on what happened the day before. It's not something where you could get a degree and then not keep up because you'll be so far behind within a week. What we truly do is that we are educators, so it's not my job to tell you what to do. My job is to give you all the information so that hopefully you can make an informed choice that is right for you and your family. The term that we use a lot is that we're non-directive. So unlike a lot of medical professionals that say, I think you should have this surgery or you need this blood test to look for diabetes, we give you all your options and help talk through it with you so that you can make your own choices. And I do apologize, I'm too short to actually see the screen. So, so common reasons that people typically see a genetic counselor, I think this one is one of the ones where a lot of people have done it, is because they have a family history of a condition and they want to know if they're at risk for inheriting it. A lot of people now are getting offered genetic testing when they are planning a pregnancy or are pregnant. They're symptomatic, so they want to have an answer to why they're having the symptoms that they're having. They want to learn about inheritance for whether or not they can pass that on to additional family members. Or in my most common situation right now as a pediatric genetic counselors, they're seeing us because their child is having some concerns. So our mantra is the right test for the right patient at the right time, because genetics is not something where we can say, okay, you come in with X, Y, and Z, this is what you should be having. So this always reminds us to slow down, think about why the family's approaching you, and what is the best thing for that family. And there's different types of genetic testing depending on where you are. So the most common is diagnostic testing. This is the one where you are having signs or symptoms, so you are testing to identify the why. Carrier testing is for conditions that an individual can pass it on to future generations but may not have symptoms themselves. And then predictive testing is used when a person is at risk for developing a genetic condition but does not yet have symptoms. Additionally, there's prenatal testing, which is offered during pregnancy to identify if a fetus has a certain disease. Pre-implantation genetic diagnosis, which I'm going to touch on briefly today, but will be explained a lot more this afternoon, is either a screening test, depending on what you're doing, or a diagnostic test to determine if an embryo has the disease before it's implanted. And then newborn screening, a lot of people don't realize that you have this in all states here unless you opt out. But these are a screen that is performed right at birth for diseases that need very quick intervention in order to help eliminate symptoms or help to manage symptoms better. A lot of people know this as the PKU test, even though that's only one of the diseases that we look at. So why get testing? I think that everybody has a different reason for why they might explore genetic testing, and that for no two people are there ever going to be the same reasons. So for some individuals, they want to have that answer to why. Others might be thinking about family planning. Sometimes in certain genetic conditions, we know that a diagnosis can actually impact your management because there may be certain drugs or therapies that are more beneficial. Access to services is a huge one. So a lot of times we see, especially in the pediatric population, that having a name instead of a summary of symptoms actually improves access in the school and with healthcare services. And the results may impact your ability to do things in the future. So it may either speed up your timeline for doing some of those things you really want to do, like travel and retire. But on the flip side, there's just as many reasons why people may choose to not get testing. A big one is that genetic testing, and some of you may have experienced this, it actually can raise more questions than answers. So genetic testing is not one of those nice black and white things. There's a lot of gray. So sometimes it can lead to more confusion. A lot of individuals are concerned that a diagnosis may lead to discrimination, and we'll come back to that one in a little bit. They may feel that their control is taken away from them because now their diagnosis is in control. You'll also notice that a couple of these things are the same because I had family planning and lifelong goals were on both slides because depending on how you view it, that may be a pro or a con to genetic testing. And I think one that I've heard over and over from our families too is that there's a certain amount of guilt associated with having a genetic change and then passing it on, even though none of us have any control over our genes and what they do to our bodies. So briefly about discrimination, there are some really great resources out there, and I have it at the end of my presentation for you because I know this is a really busy slide. In 2008, GINA, which is the Genetic Information Non-Discrimination Act, was passed. It is a federal law that protects people from genetic discrimination in terms of health insurance and employment. So this does not apply to things like life insurance. What it essentially says is that you can seek genetic testing, genetic counseling without fear that there will be genetic discrimination on the behalf of your insurance company. Now the trick is one, that this does not actually apply to everyone. Interestingly enough, it doesn't apply if you have TRICARE, which is the military insurance, if you have the Indian Health Service, or if you're a federal employee. They have a separate law that is supposed to provide the exact protection. You still can have some discrimination based on your symptoms under a health plan. So they cannot use your actual genetic diagnosis, but they still can use the medical concerns you have. What it means is that by getting genetic testing, you're not increasing your risk of discrimination over what was already unfortunately there just by having symptoms. Now there has been new laws put into place recently that help protect people from pre-existing conditions. So there's lots of hurdles on the path to genetic testing. So the first is finding a provider who can put it all together. We hear this lots of times. At Children's Hospital, we take care of patients from the whole entire Rocky Mountain region. So we have a really diverse population and lots of people from rural areas who have not seen a specialist before they're able to come to our hospital. So the first step is getting seen by somebody who can actually put all the pieces together and recommend the appropriate genetic testing, not just some generalized tests that they don't know how to interpret. Unfortunately, once you have the provider in place, then comes the fight with insurance. Genetic testing is not something that is standardly covered across all insurance plans. Each one is very different. And some insurance plans actually have exemption clauses where they do not cover genetic testing at all. And unfortunately, right now, genetic testing is still quite expensive ranging from a couple $100s on the cheaper end all the way up to several $1,000s on the more expensive end. So you really have to work with somebody who can go through all those insurance steps with you and make sure that you are not going to have a large out-of-pocket cost associated with this. Some of our labs do offer patient protection services, which can help cut down on that cost as well. But again, it's knowing which labs offer those protections for the family. And then the biggest one is probably interpretation of results, because unfortunately anyone can order a genetic test, but not everyone actually knows what those results mean. So I've had so many families that have come in that have a result and were either told one thing or were just handed the results or mailed the results and not actually had any explanation. And genetic test results are not straightforward, so they really do require somebody who can look through those results, look at what the genetic change is, and really interpret whether or not that's a causative change. We've actually had families that thought they had a diagnosis for years, and they came to see us, and it turned out that somebody had misread that report years ago, and they were actually walking around with the wrong diagnosis. And that can be really important because different diagnoses come with different therapies, different prognosis, really makes a family attack it very differently. So you get through all these hurdles if you're lucky. Now what? Sorry, apparently I hit the wrong button. So genetic testing that confirms a diagnosis can often give us information that guides management, more importantly probably provides risk information to family, and allows for connections with others that have a similar diagnosis, like through things like this conference. However, it's not always clear-cut. And a lot of times families are left with a lot of questions. Additionally, genetic testing doesn't result in the crystal ball prognosis, which is what I know everybody wants when they come in is, okay, how does this impact me specifically? And that's the hard part about genetics is that we don't know all those answers. We may be able to identify an underlying genetic change, but we still don't have a great idea of how all of our genes work together, how environment plays into that, how lifestyle changes play into that. So we can give some guidelines, some general information, but sometimes families do walk away feeling like they didn't get many more answers, and that can be a really unsettling feeling for them. So once we do have the results, then it becomes a family affair. So one of the things that I always stress is that, yes, your genetic testing results belong to you, but in genetics, they really are information that the whole family is impacted by. And so the biggest challenge that I come across with family is, how do we go about sharing these genetic testing results? And a lot of it is really based on family dynamics, so how your family interacts with each other, how they share things, or in a lot of cases, how they don't share things. Not everybody is from a Leave It to Beaver family, so some of us may not have open discussions with family members about what's going on from a health standpoint. So it's something to really put a lot of thought into. I've had families do it lots of different ways. Probably my favorite way is one of our families of a pediatric patient hosted a party. And they invited all of their family members and their friends that they wanted to know, and they told everybody all at one time. And they made it into more of a celebration type thing versus feeling like they were sharing negative news with everybody. Other individuals like to do it by letter or by one-on-one conversations with families. So I think one of the things that we can do is that we can talk about how to share this results with your family, and then how to anticipate the reactions that may come. So some of the things we have to think about, I already mentioned family dynamics. The second one is that some family members may decide that they don't want this information, and that can be really hard when you feel like they should have it. So how to go about navigating that, of telling the family members who want to know, but then letting the individuals who do not want to know let it be. And then for a very small subset of population, which we talked about a little bit yesterday in one of our groups, is the identical twin thing, because when you get your genetic testing, you may be automatically giving them some information that they may want to know, not want to know. I had a very good friend that had this circumstance, and that was the one time I put on my genetic counselor hat with her and said, you know, you should really probably sit down with your sister before you have this testing to make sure you're on the same page. So the impact on family members is a little different than when you get your genetic testing results because you're having signs or symptoms, because they may be in a completely different place. So your cycle you've completed, and now you're sharing testing with family members, and they may have their own cycles, such as a family member who is not symptomatic. Their approach to genetic testing is going to be very different because they're not trying to answer that question, why am I having these symptoms? They have to make the decision of, do I want to know if I'm going to get these symptoms, or if I could pass it on? And I think that even differs if you already have kids or if you're still in the family planning process of thinking about expanding your family. Other individuals may have been having symptoms but weren't ready to deal with them yet, and you get your diagnosis and all of a sudden they're like, oh, wait, that's probably why I've been having X, Y, and Z, and it can accelerate their acceptance process of their symptoms. Other individuals may not find themselves at risk because they decide to do genetic testing, but they may be at risk for passing it along. A lot of the disorders we talk about today are ones in which the gene can expand over generations. So they get their test results, find out, okay, I'm probably not going to have symptoms, but now I have to think about how that affects my kids and maybe even my grandkids that I don't have at that time. So really depending on where you are in your own life cycle when you get these results greatly impacts how you're going to interpret them and how you're going to be accepting of them. So the impact on family planning, this is a little different than it was years ago because we have a lot of technology now, and sometimes it sounds a little science fiction. But I always think that when we're talking about reproductive options, the first thing we always talk about is that you can choose to do absolutely nothing, and that's an okay decision. So just going about as if you had never known that there was a genetic condition in your family. Some individuals may choose to use a donor, and that can either be an egg or sperm donor. That child is then not biologically related to one of the parents, but it has a very decreased chances of having the same condition. The one that is a very hot topic right now is pre-implantation genetic diagnosis. And this is where a couple goes through in vitro fertilization, which is a process where we stimulate mom to create more eggs than she typically would. We retrieve those eggs, then match them with sperm to create embryos outside of the body. We can then actually do genetic testing on that embryo and look to see if that embryo has the genetic condition, and then only implant the embryos that do not. This is the most expensive of all the options. So on average, we're looking $20,000+ depending on the center that you're using. And it requires quite a bit on the behalf of the mom. And right now, insurance companies are tending to not cover this, although there's starting to be some exceptions. The other option is prenatal diagnosis, and these are techniques that have been around for a while, and they include taking a sample of the placenta very early on because our placenta and the baby have the similar genetic information. Or taking a sample of the fluid surrounding the baby later in pregnancy. Both of these can be used as diagnostic tests. And then the final one is there's always adoption as an option for expanding a family. So I use pedigrees, and I don't know if anybody has seen one of these before, but squares indicate boys, circles indicate females, and if they're on the same plane and connected like our individual, sorry, ooh, I'm not good with this, I'm a little shaky, right here. So I just wanted to use this as an example of how the genetic testing can impact different family members depending on where they are. So my case is a 16-year-old boy who has been diagnosed with an autosomal dominant ataxia, meaning that there is a 50% chance that one of his parents, there's a chance one of his parents carried it. And it has variable expression, so even within the same family, we don't see the same type of symptoms onset at the same age. So they talked to family, and the parents decided to get tested to see if either one of them carried the change so that they could provide information to additional family members and identify whether or not they could go on to develop symptoms even at their age. It was found that Dad was positive, so then the information was shared with Dad's side of the family. From there, his parents opted to get tested, and Grandma was identified. Now, Grandma's been having symptoms that she had just been associating to getting older, and now she's thinking that maybe it was due to her underlying syndrome. Looking at all the other siblings, the sister who is currently pregnant opts to get tested. And she is found to be a carrier, and now she's already in her pregnancy and is feeling a lot of unease and uncertainty with what to do at this time and has a lot more stress than she ever anticipated. And that's one thing to always highlight is that genetic testing given at stressful times in life can have a very different impact than if it's given at other times during somebody's life cycle. Then we have the brother on the far side who opts not to get tested. However, his daughter is 18 and decides she does want to know. So she gets her test results and she's found to have the genetic change, which automatically tells the family that her dad also has the genetic change. So now there's some ill feelings between dad and daughter because dad did not want to know this answer, and by her getting testing and telling him, he now knows his genetic status without him ever giving permission or wanting that information. And then the last remaining brother gets tested and is found not to have the genetic change. And this can actually have as equally of a negative impact on siblings as finding out that you have the disorder. Part of it is there is something called survivor guilt, and it's really being looked at in families who have some of the breast cancer genes. And in those cases, the siblings who do not have the genetic change feel guilty because they did not get it. In some families that I've talked to, they actually feel left out because everybody else is going through a shared experience and they don't have that same bond with their family. And sometimes it can tear them away from the rest of their family. So sometimes getting a negative test result is as hard on an individual as getting a positive test result in terms of how they are able to interact with their family. So this is just one scenario of how genetic confirmation can impact an entire family. Each family is so different that there's no way to address everyone in the room's specific situation, but I think there's some really great resources out there if you're interested in looking more. And I was really excited when I was over at the resource table here, and they actually had some of the same resources that I utilize on a regular basis. So if you are interested in having more formal genetic counseling, there is on nsgc.org, there is a Find a Genetic Counselor option. I think that we do have a different skill set than geneticists and neurologists and primary care providers, so I do think it is a beneficial thing, but I may be a little biased. If you want to find out more information on GINA, which was the Health Non-Discrimination Act, there is an excellent website, ginahelp.org. I think it's probably one of the easiest websites to navigate and had lots of great information on there. The Does It Run in My Family Toolkit, which is from the Genetic Alliance, and there were brochures out there regarding this one. And then to learn more about the ways that genetics is a part of your life, genesinlife.org is a really great website as well. Thank you.